Legacy family, I'm Dr. Jonathan Bookout, a general dentist in Evans, Georgia, and I'd like to take just a few moments of your time to highlight why I think digital dentistry can impact your life as a patient in several ways. When I think about my patient experience, I can remember going to the dentist and them going over x-rays and me really not understanding exactly what they were speaking on. You have a fractured tooth, or I have this impacted third molar. Well, for me, as I have begun to practice, digital dentistry offers a new avenue for us to help you as a patient understand exactly what's going on in your mouth. We have what's called an intraoral scanner, and it allows for us to replicate what's going on in the mouth on a computer screen right in front of you. I think this is so helpful because it allows for us as educators to give you the ability to understand exactly what's going on in your mouth. It may not be a fractured tooth. It may not be a actual, impacted third molar. It could be that we want to talk about how we could redesign your smile. It's, the thought process of being able to show you what a soft tissue lesion looks like. And these are fantastic tools to give you the ability as a patient understand why, as a clinician, we might recommend some type of treatment even when you don't feel like anything is going on. I can also remember when I went through dental school and we had to take impressions on each other. And if you've ever had impressions, you know that they are a patient's worst nightmare at times. You can imagine that you have to sit for several minutes in the chair with all of this material kind of oozing out over the teeth as it's sliding down the back of your throat. And if you have a gag reflex, honestly, just forget about it. So to make us much more efficient, intraoral scanners has given us the ability to again scan the patient in a matter of moments without using any of this material. And I cannot tell you how many times patients have been so satisfied by the fact that they were able to do these impressions and move forward with their treatment without having to go through that alginate impression and have to sit there with that material going down their throat. I also recognize that as patients, we have lives that we want to live. And, we want you out there smiling. We want you out there being able to enjoy the moment. But we recognize that as the services that we provide, we're limited by the ability to perform those within a timely manner. And so, in that circumstance, digital dentistry offers us a much needed avenue to speed the process up rather than us having to send out those physical impressions to a lab and have them take weeks to receive it. And then it takes more time for the clinician to actually go through, design the case, build it back, and then send it to us, again, waiting time for it to be shipped. Not to mention that it could be lost at any given time through the system. Now, in digital dentistry, we have programs that allow us to encrypt the files and send them to a lab safely so that it can be interpreted, it can be modified, it can be replicated. And these factors give us so much more power to be able to expand on what we can offer patients in a timely fashion. The concept of building a digital archive of what patients have had in the past, as well as what they have experienced throughout the time that they've worked with our clinic. You can imagine with us that a patient may be unable to receive care because they're unable to get a ride to bring them, they may medical transport. There's a number of reasons why patients would be limited in the ability to come to the clinic. Well, if they lost a tooth, if they broke their denture, if a crown was to fracture, or even a veneer had come off, rather than them have to go through all of the steps again, digital dentistry offers us a pathway that now allows us to say, hey, lab, we need to have that same case replicated again. Can you send this back to us? And in a matter of a few days, we now have that new replication of what we did before. And I think this makes a massive improvement in a patient's life. Again, I'm Dr. Jonathan Bookout, the founder of the Legacy Dental Group here in Evans, Georgia. If you found this information at all educational, we would love for you to give us a follow. Share it to someone who really deserves that next step in their oral health journey. And we love to hear from you. Leave us a comment down below.